Hi, good morning. My name is Merlane Boniani. So I'm very excited to share my quality improvement project today with you. In my QI project, I aim to decrease 30 days readmission among heart failure patients at NYC Health Hospital Kings County. Our project objective is to reduce 30 days readmission rate for heart failure patients by 20% within the next 12 months. In pursuit of this, we shall undertake various critical interventions, like intensifying discharge planning, follow-up care, and predictive analytics to help identify the most vulnerable patients. After discussing with the hospital management and pursue the data, we discovered that the hospital heart failure readmission rate is higher than 22 national average rate, in approximately 25%. In our findings, we found that variability of follow-up appointment time from the schedule, lack of consistency in patient teaching, and the absence of standard practice and discharge all contribute to the above. The above findings make the need for change categorical. So, what's the aim of this project? Well, have set a smart goal. We are focused on reducing heart failure readmissions. The target to reduce readmission rate is by 20%. Based on evidence from institutions like Mayo Clinical and Cleveland Clinic, this is possible with the right intervention. This project tackles a serious issue that affects patients' outcome and healthcare costs. We are aiming to hit this target by July 2026. In addition to these overall goals, we also have process goals to achieve follow-up appointments rate of 7 days after discharge up to 90% from 60%, and receive discharge checklist on 100% of heart failure patients within the next 3 months. This plan is based on some core research. For example, research has demonstrated that transition care models decrease readmission in research conducted by Lee et al. 2020, follow-up in planning discharge lower readmission by 25%. Patient teaching is also essential. Stalma et al. 2023 indicate that teaching the patient the condition and how the condition is managed decrease readmissions. That is a critical element for our plan. Lastly, predictive analytics make a difference. Near et al. 2024 research report that applying data to predict the most likely patients to be readmitted allow individuals of the care and better outcomes. To implement these changes, I'll be using the model for improvement. This model answers only 3 simple questions. First question, what do we want to accomplish? We want to decrease 30 days readmission from the hospital in our heart failure patient population by 20%. How will we be sure things have improved? We will look at readmissions, adherence, and patient satisfaction on follow-up visit. What needs to be altered? We will develop a standardized discharge checklist, patient programs, and expanded use of predictive analytics to identify high-risk patients. Now, let's talk about how we'll measure success. So, we will be tracking the reduction of the 30 days readmission rate from 25% to 20%, an increase of our target goal to 15% from 70% to 85% adherence. And we will also follow up the percentage of patients who schedule follow-up care in 7 days and those who take discharge checklist to help us ensure that we do not create new issues We will monitor staff workload and patient satisfaction and the discharge process. In conclusion, this project aims to enhance our heart failure outcomes further and decrease the readmission rate by applying evidence-based interventions. Safer transition of care, improved communication with the patients, and the application of predictive analytics to the benefit of target intervention remain our goal. In the upcoming year, we will stay on track with our follow-up, make the necessary correction as indicated, and look forward to accomplish the goal. Thank you. I also look forward to the benefits this project will have on the care of the population of Kings County. Thank you.